keeping with the theme of prevention, the committee was charged with examining the role of protective equipment in preventing concussion. The committee found little evidence that current helmet designs reduce concussion risk in young athletes and found no evidence that mouth guards or facial protections, such as face shields in hockey, reduce concussion risk. The genesis of this finding lies in the biomechanics concepts that were discussed earlier. What the literature tells us is that diffuse brain injuries like concussion are caused by a combination of linear and rotational forces. What we do know is that helmets reduce that linear portion. There's limited evidence that they can manage the rotational components of the impact. This is in part due to standards. Helmet test standards were initially designed to evaluate a helmet's ability to protect against skull fracture and more serious brain injuries, and they do an excellent job of doing that. What we don't know, what the standards don't do right now, is evaluate a helmet's ability to protect against the rotational components of that impact. And therefore, the helmet standards do not comprehensively evaluate a helmet's ability to prevent concussion. But the most important concept of this section of the report goes back to the injury thresholds and injury risk curves that Dr. Margulies presented. Until those quantitative relationships are defined, which relate the engineering measures of linear and rotational acceleration to concussion risk, we don't have the data upon which to evaluate a given design's ability to prevent concussion. And this has led to our fifth recommendation, which is that the National Institutes of Health and the Department of Defense should fund research on age and sex-related biomechanical determinants of injury risk for concussion in youth, including how those injury thresholds are modified by the number and time interval between head impacts and concussion. Simply until we have this fundamental data, we cannot determine whether a given design of a protective equipment can mitigate concussion risk or not.